Hi, welcome to Dr. Chaudhary's Homeopathy. Here I am Dr. Venkat Chaudhary, Senior Homeopathy Consultant. Here I would like to share a case experience. Case is seronegative rheumatoid arthritis complicated with SLE, that is discoid lupus erythematosus. This video is particularly for the students and who are practicing budding homeopaths, and also who are interested to learn mind method also. I hope this video will helpful to you. So before going to the case, please read the PPTs of case sheet and understand it, and then watch the analysis of the case. Hi. So coming to the case, this is the case of seronegative rheumatoid arthritis with discoid lupus. So first of all, I would like to say the whole case. This is not as a traditional case sheet. So I just put the whole conversation between me and the patient. So how the patient arrived to the clinic and how she behaved in front of me in the clinical chamber. So the entire behavior, the narration I put in some of the pages. You just read and follow the conversation between me and the patient. So before going to the depth of the case, I just read the case. This is the case of the 50 years old lady. She's a wife of headmaster of the government high school. So after entering into the clinic chamber, I offered a chair and she sit silently. So instead of her narration, her husband started the conversation. The conversation between me and husband like this only. Husband told like this: she has been suffering full of joint pains since so many years. I showed her all doctors in the city, but still she is telling the same symptoms. So while telling these narration, husband shows so much of frustration because she visited so many hospitals, so many doctors to show her in the city, but the result was in vain. Though husband is telling like that, she sat silently without a bit of word from her. So meanwhile, treatment is running, allopathic treatment. She developed psychological symptoms, and she went to the psychiatrist also. She has taken some of the psychiatric medicines. So finally they opted for homeopathy. Some of the old patient referred to me for homeopathy consultation. Before that, he expressed that some said me, the husband of the patient said like this: some said to me, go to homeopathy. I know one doctor in Bangalore. He will give result in this type of cases within 1 week. But I thought that is far city. Then I searched about your address. So I brought her here. Sir, you treat her within short time. Already I vexed spending so much of money. So this is the frustration of the husband showing before me. Until that time, she did not the patient did not spell even single word about her complaint. Simply, she was observing me and her husband on and off with bending head down. I smelled something she has in mind. I decided to send her husband outside the chamber, made request to go outside and spend some time outside my chamber. Then I started my interrogation. Tell me something, ma. I offered a question. So patient then started. I have body pains, neck pains, joint pains everywhere in my body since 8 years of time. I took medicines from the specialist. Finally, one of them referred to rheumatologist. He diagnosed seronegative rheumatoid arthritis. He started treatment with powerful medication which I can't bear those tablets effect. Since 2 years, I have been taking those tablets, but when I leave the tablets, I again get pains. Again, I insisted some more information from her. Patient narration like this. Slowly, I fed up with the rheumatologist treatment. I used to visit every month. He used to prescribe medication. Due unbearability of ingestion of medicine, I got a depression, some psychological symptoms I developed with the sleepless nights. I developed gastric burning ulcers. I can't even eat what I wish to eat stomachfully. My life ruined entirely. Sir, can you cut down my problems? Please, sir, you are the last resort for me. Give me good medicine. Can I come back to normal health? So much I got damaged. Can you correct my life? Expressed her doubts with a pitiful look, with added tears. I put a question, since how many years you have this complaint? Since 8 years of time. Remember, madam, 8 years back, did you have any complaint? Very minor, like headache, diarrhea, rare times, 1 to 2 times, got fever. Yes, I have sinusitis also. Frequently, I get when I take head bath and change of climate. I used to take tablets like cetirizine and some antibiotics according to medical shop owner prescription. Every time my husband brings the tablets from the medical shop. Then I put a question, what happened 8 years back when you get these pains? Anything you consider as a reason? Then she told like this, no obvious reason, sir. Then tell me, what about you and your childhood and marital life in detail? Because I insisted to study the life history of the patient since childhood, because at present symptoms she could not tell anything more information. So I poked her. I want to poke her childhood, since childhood to up to marital life. Patient told like this, sir, my native is very near to this town. I studied there in my village. Being in a farmer family, so cultivation is the occupation of her father. Farmer family, I used to do every work in my home, and I learnt all household work without hesitation. My mom taught everything. After that, I came to city education up to degree. I completed my LLB. During last year of my education, I got married school teacher. Now he is a headmaster, but at the time of marriage, he was a school teacher. Because of government employee, my parents insisted to get marry him. I just followed my parents' words. He has resident of neighbor village, middle class family with some financial problems. He used to save money from salary. So her husband has some problems, financial problems. He always used to save money from the salary. So at that time his salary was very little. At that time he never get a freedom to spend money. Whenever I used to ask anything, my necessities, he used to abuse me. Many times he beat me with stick. Since then I have not been asking anything him directly. If he has interest to give, then only I used to take it. So then I put a question. I got a doubt. You are a lawyer. Why did not you start your practice? Why did not you argue with him for your rights? Because she is a lawyer actually. She completed LLB. Then patient told like this, sir, I can't do practice. I don't have any experience, and I also have lower confidence to make argument with my husband or whatever may be the such situations. And how can you say a word? How can I say a word against him? He's a my husband. He is the owner of my family. Oh, I will get fear to talk against him. So this shows some of the timidity of nature. Then I put a question. I wanted to get the information of routine. I put a question, what is your routine? Patient said, I used to wake up early morning at any cost, with pains or without pains. I used to do all my domestic work with my hands only. I don't have homemade. If anybody suggests to have homemade, that means my in-laws or my parents, my hubby scolds them. So then I asked her, then what about your pains? Are they allowed to do work? Don't you feel to have homemade? Then she said like this, if he is not willing to put, how can I ask? I do my work whatever cost up to my energy exhaust. I do making nut into dal with grinding stone. I wash all clothes of my family members, mopping floor and cooking also. But actually, her husband promoted as a headmaster 5 years back. He is drawing 70,000 above, but she is not ready to put a housemaid in these conditions also. He almost behave and thinks she should manage everything. This is the husband's mentality. So he is not interested to put a housemaid also, now also, at present also. Then I put a question, what do you want right now to your life? I lost my life with my ill health. What can I do? I can't change my husband at all. He's always like that only. Only thing is, only look after my children with my husband up to my energy permits. Then I put a question, your plus points and minus points. So this is the general question I put. Your plus points and minus points. Then she said like this, kids are studying in city. He goes to school early morning. I always feel fear to be alone. Every day I used to wait for his arrival. When alone, when I hear sudden sounds, I feel palpitation and anxiety. When he scolds me or anyone criticizes me, I feel hurt. Easily I get hurt. But I can't express it. I keep it in my mind, sometimes weep also. So this is the patient narration. Then I asked one question, didn't you feel your husband's behavior? Patient suddenly started weeping before me. I really felt bad when he beats me. He doesn't give much care for me, even caressing words since marriage. It has been happening, but Anytime I did not tell to my this is the routine process. He is abusing me, but anytime I did not tell to my parents. I kept everything in my mind only. I'm his wife, I should bear everything once I get married. So this is her commitment in the marital life. This is her commitment. Sometimes I get anger about his behavior, but I should bear it, she sighed. So, but pain is there in my mind by the behavior of my husband. At this time, I think only to serve my family. I should brought up my family rather than my health. So, she's so committed person towards her family and her husband and her children. Then, I put a question: what do you feel about your present health status? Patient said like this: I took so much of medication. He brought me here to your clinic now. I don't think I would come back to healthy state because my health was totally spoiled by the medication and by the rheumatoid arthritis and the psychiatric drugs also. Doctor, you tell me, can I come back to normal? Almost my health spoiled. My mind get disturbed, becomes dull, aversion to domestic work, wants to lie down before menses since 1 week. After periods, I would be okay. Menses are regular, everything is okay. I feel sad before the menses. When rising up morning with pains. How can I do this day complete my house duties if I would be in bed? Though I feel little bit pains, I should complete my work. This is her commitment towards the domestic works. I think otherwise, how will go to his how he will go to his office? Sometimes I feel hesitate to do it. Simply slept for some more time. Every day afternoon compulsory I watch health related programs about all treatments including homeopathy, Ayurveda, allopathy, the other health programs coming in the television. Doctor, I heard in one program, you tell me the SLE has no cure. I can't get back my original skin. He said in program some may die with this disease also, isn't it, doctor? Little bit scared, feel anxiety after hearing the words of the doctor. So this is the case narration, the conversation between me and the patient. So you please follow the PPTs and see the before the treatment phase of the patient. This is the discoid lupus, all dark pigmentation is there. So all over the body the dark pigmentation went on. Okay, so come to the analysis. So before going to the analysis, how I reached the medicine, here I put all over the rubrics of the case. So please follow it. Rubrics taken for the case is, so the rubrics, first of all, I went general behavior of the patient before the sickness and the symptoms which are continued after sickness also. So this is the constitutional treatment. So I went through the mind method only. Here are no more physical symptoms. I just give you a bit the thermals only. So the symptoms are submissive behavior, indecisive, servile, dependent on others, carried desire to be and caressed, timidity, cares about domestic affairs, industrious, fear of being alone, desires company, introverted, silent grief, mind menses before, responsibility taking too seriously. So these are the general rubrics. So these rubrics are these symptoms appear before sickness of the patient, and during sickness also these symptoms coming up. So the other rubrics, so causative factors which gears up the disease process. So what are the causative factors? These causative factors only from the healthy status to they gears up the disease process. So there are three symptoms: ailments from the rudeness, ailments from abused in marriage, ailments from grief. Three are the causative factors I have taken in this case, and there are symptoms developed during process. So from the case I have taken anxiety, hypochondriacal mania to read medical books, and discouraged with praying, doubtful recovery of, helplessness feeling of, the last one, horrible things, sad stories affecting her profoundly. These symptoms appeared during this disease process also. So coming to the explanation of every rubric, these symptoms, the first one is submissive behavior. Why I have taken this rubric for the repatriation? Where the submissive behavior happened in her life. Submissive behavior. So here I was observed one thing, that she did not start her case narration herself. Instead of her husband started the case narration. She even did not spell single word until the husband completes his narration. This nature shows that her husband's dominating nature here, as well as the submissive behavior of her. And second point also, in her life course, if you observe the life course of her, even she would not ask anything him directly. When she asked, he used to abuse her. She has that fear. So she has been spending her life without making an argument with him. So this also, the obedience also tells us the submissive behavior of her. And she also narrated one thing during the case conversation. She used the words, she narrated like this: how can I say a word against to him? He's a husband, he is my husband. He's the owner of my family. So these points elevate the nature of submissive behavior, as well as some kind of surveilling nature is there. So if you come to the meaning of submissive behavior, inclined to willing or submit to orders or wishes of others, characteristic of a slave or servant. The another meaning is obey someone without arguing. Here also she expressed and she has shown the behavior. He just followed her husband's orders. So the next symptom, indecisiveness. In her marriage issue, though she is a graduate advocate, she passed undergraduate degree, she did not oppose it, her husband's behavior, and also she has no idea what to say to her parents. This and the marriage issue also, she has not opposed. The parents proposed to marry him, and she obliged the decision of the parents. Just she followed that. So this shows the indecisive nature of her. At one point, after the marriage, at one point her husband has showed many doctors, but the choice of doctors, including homeopathy also, not in our hands. Just she came here, and because of her husband's intention. Here she has no such a decision making nature, what to select, when to select, where to select. So she has no such decisive capacity. So I took the rubric indecisive nature. And third one, servile. So here see the pic, the meaning of the servile, too eager to obey someone or do things for him. Here in this case, she has shown the character. When I completed please observe the PPT narration. When I completed my LLB, my parents forced me to get married. I just followed my parents' words only. This is the surveilling nature, and here the taint of indecisive nature also comes. And second thing is, I am his wife. The narration, look at the patient's narration. I am his wife. I should bear everything because he is my husband only. Though she gets anger, but could not express it on him. So she accepts his dominance to serve him. So this is the surveilling. This tells the behavior, tells the surveilling nature of her. Come to the other rubric, dependent on others. In marriage issue, while she is getting married, every decision she left to the parents only, and after marriage every decision she left to the husband only. In marriage issue also, she just followed what parents said. Coming to this clinic, to my clinic also, he is not her hands. She just depend on the decision taken by the husband only. So I took the rubric dependent on others. So please go through the definition of the dependent. And the next rubric is carried desire to be caressed. Carried desire to be and caressed. Here go through the, if you go through the patient's narration, but that narration is, but I got this feeling by observing the patient's narration, her feeling. And husband should not be like this rude person. So she feels that she tortured from the her husband's behavior. His nature is not okay. He would abuse it every time if anything asks. So he has shown his frustration on her every time. So this is my observation while narrating the case by her. The feeling of husband should not be like this, should not like this rude person. She wants a smooth behavior from him. So see the caressed. Caressed means touch or stroke lightly in a loving or endearing manner. So this type of feeling she wanted from her husband. So I have taken this rubric, carried, desire to be and caressed. So the next rubric is timidity. You know very well timidity. So where she expressed the timidity, here she shows fear to argue with him. This is also timidity. So fear to argue with the husband. At the same time, fear to talk against him. She has no courage to fight with him, though anger comes in mind. So if you come to the meaning of the timidity, lack of courage or confidence. So come to the next rubric, cares about domestic affairs. So domestic, the domestic means concerning with the running of a home, family or country. Here home only she expressed, and she sacrificed her life to her family only. So I have taken this rubric, cares about domestic duties. And the next rubric is industriousness. So meaning of industriousness, hard work and perseverance. She has shown at everywhere, every time. She has no housemaid. She used to do all her work without asking her husband's help also. She does making nut into dal, all difficult work she only used to do every day. And clothes washing also she has to do. This shows the industriousness of her. Okay. So the next rubric is fear to be alone, fear of being alone. So every day her husband goes to school, her children go to the school. She will be alone in home after they went out. So this thing fears her so much. So I have taken the rubric fear of being alone. So that alone means lacking companionship. So after they went out from the home, she felt very loneliness. So she fear of being alone. I have taken the rubric. So the next rubric is despairs company. Desires company. So fear to be alone drives her to have some company, but that is not possible in her life. Every day she waits for their husband and children arrival since so many years. So I have taken the rubric desires company. The next rubric is introvertedness. Though she has been suffering since many years, she used to keep everything in her mind. She never goes to tell the issues what are happening in the family. Never goes to tell her parents, her relatives. This tells her introverted nature. So introverted means the quiet, reserved and thoughtful individual. So this type of introvertedness I have looked in her. The next rubric is silent grief. This introvertedness throws her into silent grief. That means without expressing her feelings or whatever may be, with strong expressiveness, her emotions is not in position to express her emotions strongly with the world. So she pent up with the grief, silent grief. I have taken the rubric silent grief. Here grief means not expressed directly or outwardly. It is the meaning of silent grief. The next rubric is mind menses before. So usually premenstrual syndrome is there. Before menses, she used to get some of the symptoms: irritability, dullness, aversion to domestic work, becoming dull, desire to be lie down, wants to be lie down. These are the symptoms every time she has been facing since the menarche. So mind symptoms before menses. I have taken the rubric. So the next rubric, responsibility taking too much or too seriously. Here her nature is like that, very careful about the family and loves his family and cares about the domestic work. So though she is in sickness, she used to wake up early morning, does every work of family, domestic. So it is very regular. She put a question. If in her narration, I observed one thing, the narration of the patient, If I would be in bed, how can I complete my household duties? At any cost, I should complete my work. This is the narration, this is the mindset of the patient. So I took, this is very responsibility. I took the rubric responsibility taking too seriously. So the next rubric, coming to the causative factors. So those rubrics I have discussed earlier, those are in healthy status before the sickness develops. Since so many years she has been suffering from the symptoms. So here by the ailment, by the causative factors, what factor triggers her towards the pathology? These are the causative factors of the case. So I have taken 3 rubrics. Ailments from rudeness. So you already know the rude behavior of the husband, so I need not explain more. And the next, ailments from abused in marriage. So here the marriage means it's a commitment. It is the commitment between 2 persons. It is the marriage. So in her married life, the husband commitment was failed. So he abused more and more. So she committed to the marital life. So I have taken the rubric ailments abused in marriage. So this abusiveness means abnormally using, expressing offensive reproach towards others. This is called abusiveness. So other rubric I have taken ailments from grief. Ailments from grief. You already know she has been with the silent grief. So this grief also imbalances the hormones and imbalances the sympathetic and parasympathetic of the system, endocrinal levels. So neuroendocrinal system, it disturbs the long grief or long time causative factor. Here she has been suffered with this grief, so I have taken the rubric ailments from grief. So coming to the symptoms developed after the sickness, during the course of sickness, symptoms, some of the symptoms developed. The first symptom, anxiety, hypochondriacal mania to read medical books. So how what is the hypochondriac nature? So coming to the meaning of the hypochondriac, fear of minor bodily illness may indicate serious illness, constant self-examination and self-diagnosis, and preoccupation within one's body. Where she has this nature. So being alone, being a sufferer, she used to watch all the programs of health related in television every day. So whatever may be the program, though it is the allopathic mode of treatment or Ayurvedic or homeopathy, whatever may be, she used to observe and she used to check all the symptoms over her. So this is called anxiety, hypochondriacal mania to read medical books. Here, by observing the television programs, health related programs, and reading medical books, whatever may be, she possessed anxiety nature. So I have taken this rubric. And discouraged with praying. The next rubric is discouraged with praying. If you observe carefully, while opening the case, her narration was like this only. Earlier treatments all are failed. I am fed up with all treatments and taking medication, visited many doctors. Finally, I am vexed with the medical treatment. She asked me to get out of such crisis with a pitiful look. So I asked, she asked me to give me good medicine. You are the last resort of me. All are in vain. All treatments are in vain. you are the last resort. So almost all with the closed hands. So I took the rubric discouraged with praying. So why I have taken here discouraged? Discouraged means she tried all the treatment, but she lost her hope to get back her health. So this is the discouragement. So I have taken discouraged with the praying, the praying mode of asking. The next rubric, helplessness feeling of. Helplessness feeling of. So in the case narration, all treatments are in vain, doctor. She feels that I lost my life, my entire life is spoiled, my ill health, what can I do? My health also spoiled, so I got ill health. So what can I do? She expressed pitifully. So I took the rubric from the narration, what can I do? So there was no help to get back her health. So she felt like this helpless, she was in a helpless state. So I have taken the rubric helplessness feeling of. So because of vexation of all treatments, though she met many doctors, no one cured her. So I have taken this rubric. So the next rubric, horrible things, sad stories affecting her profoundly. So while observing, why I have taken this rubric? So while observing TV programs, advices, suggestions, warnings of the doctors, that someone said like this in one program, some may die with the lupus erythematosus, this diseases. Patient expressed the fear, sir. Some doctor advised or give the warning that some may die from this disease. After hearing this type of programs or this type of comments, I am that lead to get anxiety and fear. So I have she expressed like this. I have taken this rubrics, horrible things, sad stories affected her profoundly. So there was one more rubric, doubtful recovery of. I have taken in her narration at every point she expressed, doctor, can I come back to normal health? Your treatment will work. So will your treatment will work? So at every point she expressed so many of doubt about her recovery. I have taken doubtful recovery of also. So after repertorizing these symptoms, I have reached the remedy. Completely covered remedy is pulsatilla. I have used in this case pulsatilla 30, 200, 1M. Almost all 8 months treatment I have continued over the patient. So she got a good result. Observe the pics. After treatment, she has got good result. All the eruptions, the discoid, lupus, erythematosus eruptions, that black pigmentation also gone completely, and she felt so much of happy. All her pains are gone. So after 8 months of treatment, she discontinued with the full happiness. So here some points I want to discuss with you about the pulsatilla. So after reading this case thoroughly, I came to some of the points to be noted here. That first point is, pulsatilla courage does not allow to make revolution. Sometimes it binds to family values, domestic duties. In case of relationship, she makes subdue the egotism rather than making argue worse. So because of argument, that bondage will go going into the breakup, will go breakup and will be spoiled. So instead of going to argument, she subdued the egotism, her egotism. Here, the patient subdued her egotism. So, this is the pulsatilla nature. The second point is whatever the situations, worse, husband is God, is the one type of religious nature towards the husband. Here, he tortured so many ways. She pent up with the grief, whatever may be. Finally, pulsatilla shows the religious nature towards her family, towards her husband only. Here, in pulsatilla mind, husband is the God, no other time. So we may find the pulsatilla under the religious rubric, religiousness. So one more point is she bears everything because she is so dependent, timid person, religious person with lower confidence, indecisive nature towards her life. So that only the timid nature, dependent nature, the religious nature and the lower confidence, this thing leads her to bears everything, whatever the husband does in her life. So she bears whatever may be because she is a timid person, she is a dependent person, she is a religious person, she has lower confidence levels. Another point is she knows the actual reason of getting ill health, but she doesn't want to expose it in front of others. Her husband behavior is the reason. This is the hypocrisy of pulsatilla. This is the hypocrisy. She doesn't expose her husband behaviors. Always she behaves like I'm okay. So this is the hypocrisy of the patient. Initially, the next point is initially I felt it staphysagria because the bearing nature of staphysagria, indignation nature of the staphysagria. What is the difference between pulsatilla and staphysagria here? Staphysagria bears everything. At one point, she will burst, but can't fight alone. She fights decently. Staphysagria is a cowardice to express his opinion. She approaches through help of judiciary or with gathering, makes strikes in presence of others. Pulsatilla won't fight alone. Staphysagria won't fight alone. Always the staphysagria patient wants judiciary help or making strides. The staphysagria won't fight violently. So that we see staphysagria under the rubric of indignation. The next point is cocculus also the same behavior, it expresses the same behavior of the pulsatilla. So cocculus came in my mind, but they serve the family or others unconditionally. They don't expect return of love, but pulsatilla can't do it. She expects care and love, so she becomes servile. So here cocculus is shows unconditional love, but pulsatilla shows conditional love. She wants caressing from the others. She wants love. She wants care. So this is the pulsatilla nature. So another point is pulsatilla is also under manipulative in this case. To get love and caress from husband, she takes all the domestic work. So she is in sick. One day he will understand. She thinks like that. One day the husband will understand me. I will get his love. Though pulsatilla is a kamchor, manipulative kamchor or trant, to get love from the husband, she turned as a industriousness. So why the pulsatilla becomes industriousness? To get love from the husband, she shows all her care over the family, over the husband, over the children, because in return she wants to get love from the other family members. Pulsatilla has this nature. So the one more point, hypocrisy of the pulsatilla in this case is covering her timidity, inefficiency to fight against her husband behavior. She tells that doing domestic is showing love towards her, towards my family. So towards her family, she expressed that I must do my domestic work. Unless I do the domestic work, who can be do that work? So this is the hypocrisy of the pulsatilla. So this is the case of the seronegative rheumatoid arthritis. Almost all complaints are gone off after taking the pulsatilla. This is the how to treat autoimmune diseases, how how depth we must go into the patient. This is the case. Thank you for observing.